speaker is Dr. Jiang, who is currently an associate professor at Peking University. She has over 100 publications, and she was recently awarded a grant from the National Excellent Youth Foundation here in China.
Thank you for the kind introduction, Ms. Chairman. As one of the organization committee member, I'm so honored. And I hope each participant will enjoy this meeting and enjoy your trip in China. And my topic today is a quality analysis of traditional Chinese medicines based on quantitative NMR. And my introduction will include these three main parts. And in the third one, I will use the recent related research work in our group at CASES to introduce the quantitative analysis and quantity analysis of qHNMR of traditional Chinese medicine. First, let's see the development history of NMR. You can see from the 1990s, there are many new NMR technologies appeared, so it makes the application field of NMR not limited in the chemical structure identification, but also in the purity test, herbal identification, and metabolomics research. You can see from this picture, there is a steady increased interest in the qHNMR as method in recent publication. Why NMR was used so widely? Because it has many advantages, such as it varies the qualitative and quantitative detection to all hydrogen compounds with different structure, polarities, and molecular weights. And it has simple sample preparation and easy to recycle samples. And it has fast determination process and good stability and repeatability. And more important is that this method doesn't need the analyte reference for the quantitation. And this method, such as the 1D or 2D NMR, can provide structure information. And next, let's see the general features of traditional Chinese medicine. As for the efficacy of traditional Chinese medicine, it has been proved for thousands of years. But for, I will continue. Maybe something more. As for the traditional Chinese medicine, it has complex chemical constitution, and some of the group drug has multi-sources, and the different harvest time and processing method will influence the quality of TCM, so it is difficult for the quality control of TCM. And at present, the widely accepted method for the quality control of TCM are the fingerprint and the multi-component quantitation using the HPLC, GC, or SMS. But for this chromatographic technology, there are some limitations, such as the UV detector can only detect the compounds with UV absorption, and the mass can only detect the ionized compound. But NMR spectroscopy is a general technology, and it doesn't need the reference for quantitation. So it is very suitable for the qualitative and quantitative analysis of traditional Chinese medicine. Next, let's see why NMR can be used for quantitation. It's because integrated intensity of NMR signal, or the air and the NMR signal, is proportional to the number of nuclei giving rise to that NMR signal. And many NMR parameters will affect the accuracy and the precision of the result. So we have to make the optimization of these parameters, such as the relaxation delay, the baseline correction, or the phasing correction, and some of the other parameters. As for the metabolomics, it is a technology used in recent years. The concept of the metabolomics is to study all the endogenous, low molecular weight organic metabolites of an organism with endogenous or exogenous influence. Now it has been used widely for the new drug screening and development, and for the mechanism of toxicity evaluation. Among them, the plant metabolomics, which can be realized for the study of plant physiology, but can also be used for the quality analysis of TCM. So we suggested a metabolomics-based quality control method of TCM. Here is our research approach. First, we use the NMR, or you can also use LC-mass to determine the metabolomic fingerprint. Then you make the data precise and multivariate statistical analysis to find the discriminate components. Then, in combination with the in vivo or in vitro screening for the biological activity, those with the activity will be selected as the marker components to make the quantitative analysis. By the quantitation result, in combination with the fingerprint qualitative result, we can realize the comprehensive quality control of TCM. Now let's see some research cases. First, I will introduce the determination of dictamine in Dictamni Cortex. This plant is the root bark of Dictamnus descarpus, used for the treatment of a variety of diseases. Limonoids and alkaloids are the major components in this plant. In 2010 Chinese Pharmacopoeia, only the contents of oberquinone and fluocinolone were assayed, but dictamine, a major, specific, and active quinoline alkaloid whose content is deserved to be detected. So we established a method by the quantity NMR. You can see this is the protein NMR spectrum of Dictamni Cortex, and we selected a well-separated protein 5 signal as the target analyte signal, and use the pyrazine as the internal standard. Appropriate internal standard is very important for the qHNMR, and the internal standards should have such properties. The signal of the internal standards should not overlap with other signals, and it has ability to provide stable signal, and it should have good solubility in different solvents, and is non-reactive with long-term stability. After screening, we selected the pyrazine as the internal standard, and we also make optimization for the sample preparation, and we also optimized some of the NMR parameters who influence the accuracy of the result. And after methodology validation, we proved this method with high recovery and good precision and repeatability. And by using the equation as so in this picture, we calculated the content of dictamine And we also use the HPLC to determine the result and compared these two results together. And we found that there is no big difference between these two methods. So this result proved that qHNMR is a simple, precise, and accurate method which can be used for a routine analysis. Except for the one single compound quantitation, qHNMR can be also used for the multi-component determination. Here we use a full protein berberine alkaloid determination in Calis mohania as example. Here we determined this full compound in a single run. Only use a cheap internal standard, which is the N-styrene. As you know that the price for the reference is very high, so if we only use the cheap internal standard, it will save much money. The third case, I will introduce the quality assessment of Magnolia Officinalis Cortex by protein-MR-based metabolomics and HPLC method. Magnolia Officinalis Cortex, whole in Chinese, is the dried stem bark, root bark, or branch bark of Magnolia Officinalis or Magnolia Officinalis vertibiloba, used for treatment of epigastric stiffness, vomiting, and diarrhea. The current available quality control method is a assay of two active biphenolic compounds, magnolone and onochiol, by TLC or HPLC. Here we establish the qHNMR method. Here is the protein NMR spectra of Magnolia Officinalis. From this picture, we can find that the sample from different hepatitis have big difference, which can be also proved by the 2D doses spectrum. And we use the different multivariate statistical analysis to analyze this data. The PCA cannot realize the good separation. Then we use the HCA. From this one, you can find that the root bark can realize good separation with the stem bark and the branches bark. And this separation is due to the different content of onochiol and magnolone. And except of the root bark, the other sample were divided into two groups. And we also use the PLS to make the separation, which achieved good separation result, and which was proved by the permutation test, which proved this separation with high predictability. And we use the different method to find the discriminated marker, and magnolone and onochiol was approved to be the two main markers. And we also use this method to discriminate the different species. And the green one is the Magnolia Officinalis vertibiloba, and the black one is the Magnolia Officinalis. As we studied that onochiol and magnolone were the two main discriminate markers. So we use HPLC to determine the content of these two compounds. And you can see from the result that the different sample from the different hepatitis have the different results. Some of them have a good or have the high content of these two compounds, and the others have less compound. In China pharmacopoeia, it would require that the sum of these two compounds should more than 2%. So we can find that some of them were quantified and the other were not. And the separation in our last feature, the PLSDA make the qualified and the unqualified make a good separation. And in order to find the correlation between the HPLC and NMR data, we use a mix OMICS package to analyze these two data, and we found they have good correlation. From my research, we can obtain this conclusion. That is, the representative marker on the qHNMR and Magnolia assayed by HPLC can achieve almost the same integration as the protein MR holistic data analysis. As we know that maybe HPLC is a widely accepted method, so we can use this simple method to control the quality. And through our study, we can obtain the conclusion that metabolomics-based comprehensive analysis can supply reasonable marker for qualitative and quantitative analysis. And the combination of protein MR and HPLC can realize a better quality control of TCM. The last one is the haptic differentiation and degradation characterization of Cistanches cortex. Cistanches cortex, 肉桂 in Chinese, is the striped trunk bark, and it has been widely used in flavoring, perfumery, and pharmaceutical industry. If you use a chromatography to analyze the quality of 肉桂, you will find there is only one big peak, that is the cinnamomyaldehyde. So we use the protein NMR to determine the chemical constitution. From this figure, we can identify the totally 22 compounds from this crude drug. And we next to compare the sample from the main habitats Yunnan, Guangxi, Guangdong, and Vietnam, and we found that the cinnamomyaldehyde content are different. The sample from Guangxi and Guangdong have higher content than the other two, and we make a PLSDA to differentiate the two habitats from Guangdong and Guangxi, and we found good separation, and we make the S-plot analysis to see what is the difference from this two producing area, and we found that the fatty acid and the cinnamomyaldehyde are here in Guangxi sample, while for Guangdong sample which have higher content of sugars. And we also make a stability study of this crude drug. We found that after storage for 2 weeks, the protein NMR spectra of 肉桂take place a change. You will find that the signal of cinnamomyaldehyde decreased and some of the others increased. And when we evaluate the antioxidation, we found that the sample after storage, the antioxidation activity decreased, and we further to make a PCA analysis and to find that the some of the fatty acid and the cinnamomyaldehyde decreased. In order to elucidate the transformation process, we use the cinnamomyaldehyde as the reference to study is the stability, and we found that the cinnamon acid and the stearin were formed, and which was proved by the 2D NMR, and we make a proposed degradation pathway of cinnamaldehyde, and to draw a change of these two compounds. Last, I will make a summation for this research work. Protein NMR spectroscopy technology is a high throughput and robust analytical technology.
Thank you, Dr. Jiang. And if there are any questions for Dr. Jiang at this point?
Well, for the quality evaluation and quality control of TCM, why not we can apply peak library in combination with protonimol?
Pardon?
Peak library in order to.
Yeah, we use the peak line.
I mean the protonimol. Is the protonimol the most reliable 100%, or we can confirm it by developing peak library from different food extract? So I think that in that way, it will be more reliable to use peak library rather. Can you grab my question?
Yeah. I don't catch your meaning. Can you to explain more clearly?
Okay. So the question is that for the quality evaluation of TCM, I will say that the peak library will be more reliable instead of only using the protonimol. So can you apply that, or you agree with that? So I think that the protonimol only using for the quality evaluation will be not benefiting.
Yeah, because protein NMR is much more sensitive than the other one, so we use this one for a short determination time.
And you are talking about the patient, the store one. So in that case, I mean that the peak library, that to know the exact concentration of each component, I think that from the analysis of protonimol, it is quite difficult to exactly say that.
Yeah, I agree with you, because the NMR is not sensitive as the chromatographic, such as HPLC, GC, or FCMAS.
Okay,
Yeah.
thank you.